I'm Dr. Audrey Young, and I'm a consultant psychiatrist here at the Roehampton Priory. I treat a variety of mental health conditions, including that of phobias, which has a special interest for me because I actually see it across the age spectrum, and I'm an adult and old age psychiatrist. Whilst it's normal for all of us to have fears about particular objects or situations, a phobia is actually characterized by an overwhelming and often debilitating fear. And it's not necessary either for the affected person to feel that it is an irrational fear, but they often do feel that their response is disproportionate to the actual danger their trigger poses to them. It's often associated with the manifestation of physical symptoms, such as dizziness. Some people complain of feeling lightheaded. They have palpitations. They have tremors, feel tremulous, sweat. Sometimes they even have churning of their stomach and often complain of feeling nauseous. If a patient comes to see you in surgery, it might not automatically come up for them that they suffer with a phobia. You've got 10 minutes in which to do your consultation, and it's quite likely, particularly if it's not affecting their day-to-day lives as much, that it might come up as a related topic. Phobias can affect anyone, including children, and it's estimated that 2.4 in 100 people in England suffer with phobias. And we've also found that women are more affected than men. Research has shown that a number of factors may be responsible for the formation of phobias. Genetics and environment. If a family member is affected, then there is more of a chance of developing a phobia, both via the inherited genes, but also through the learned behaviour. Traumatic experiences, for example, so getting trapped in a lift, that can actually cause some people to develop quite severe phobias. Most phobias are treatable, so look out for them because they can cause considerable impairment for the individual. And as a GP, what I would recommend is taking a really careful history of the patient and exclude other physical causes that might mimic some of their reported symptoms. In addition to that, I think considering the comorbid mental health problems like depression, other anxiety disorders, as well as things like substance misuse, which might actually pose as a sort of psychological crutch for them. And I think the most important message here is that remember that the treatment of phobias is easier to deal with when the problem is identified early. There are various types of treatments available, and a lot of it is psychologically based. So we have desensitization therapy or graded exposure therapy. More complex phobias are more difficult to deal with, and at the moment psychological therapy is the mainstay of treatment, particularly CBT, cognitive behavioral therapy. I think what's really important to understand is that a good biopsychosocial assessment of the patient, including how they function in day-to-day life and how their phobias impact upon them, is something that we can provide here at Roehampton because we work very closely with our therapists as well as the patient to develop a patient-centered course of treatment.